2020 is coming to an end, and there's a couple of things that I would like to share with you. First of all, the coronavirus is as bad as it's been. Here in Laredo, we're seeing so many new cases every single day. We're trying to treat as many patients as we can at home, but many have to end up going to the hospitals as well. So when you've been in contact with somebody with the coronavirus, it is very important for you to be in quarantine as well. Testing, some people are testing right away, right after they come in contact with somebody, but basically you have to wait 5 to 7 days and retest if you tested right away to see if you're negative or not negative. So wait that week. Unless your symptoms start, then check yourself before then. Even though many of us like to celebrate together for New Year's, unfortunately this year the best way to celebrate is really just with your own family, not a large gathering, not extended family, and just call people and wish them a Happy New Year. Hopefully next year will be different. Now that the vaccine is out, that may change things and it may help us out. Remember that the vaccine is not going to prevent you from getting the coronavirus, but the symptoms should be a lot less. Lucky for us that these vaccines that came out are 95% effective in creating antibodies against the coronavirus. Most vaccines are not that effective. And so hopefully this is going to be very good for us. Currently we're administering 2 vaccines, the Pfizer vaccine, which you get 1 shot now and 1 in 3 weeks, and the Moderna vaccine, which you would get now and again in 4 weeks. About 2 weeks after that second shot, you should be well taken care of as far as your antibodies. Not everybody will produce antibodies, but the majority of the people should produce antibodies against this virus and be helped. The distribution of the vaccine has not been as fast as we would hope. However, the pharmacies will be getting these vaccines as well as the city, and they will be distributing these when it's appropriate. I really wouldn't call the pharmacies too often to try to ask when you can get the vaccine, because they're starting with certain groups and they will be announcing what groups will be next. And then at that point, that's when you would call in or log in or whatever you need to do to get this vaccine. I wouldn't base myself on other cities and how they're progressing, because every city is going to be differently how they progress as far as getting the vaccine out to everybody. And because these vaccines have to be used quickly, it's very imperative that whenever you do get an appointment to get a vaccine, that you're there on time, that you get your vaccine, and then they may have you wait for about 15 minutes to make sure that you do fine, that there's no reactions or anything like that. Most people have been doing fine. Some people may get headaches, some people may get arm pain. Most of the people have been doing pretty well that I know of. I don't have any major side effects or anything that from the people that I've talked to and have received. I got my shot and I did fine as well. Let's bring in 2021 safely, and let's get rid of this coronavirus. And when the vaccine is available for you, make sure you try to get that if you can. Take care, guys.